The Ministry of Health wants to inform the general public that the country is officially declared free of the Marburg virus epidemic.
This is the news that many Ugandans and outsiders have been waiting for since the country started the 42 days countdown. The first cycle of the 21 days started when a health worker was admitted at Mengo hospital. He later died.
On the 20th of October, we started the next cycle of the 21 days, which ended yesterday.
According to WHO, the days represent twice the maximum incubation period for Marburg, which is 21 days, and they start from the last day that any person in the country had contact with a confirmed or probable Marburg case.
During the period of the outbreak, a total of 197 people were followed up for 3 weeks in Kampala, Mpigi and Kasese districts.
8 of those who came into contact with the victim had signs and symptoms, but their tests by the Uganda Virus Research Institute turned out negative. But is it really possible that a country can have just one case of such a deadly virus?
For your information, several tests were run to confirm this case. We ran about 4 different tests and it was positive. And as the minister said previously, we have had one case. Actually, that was one case of Ebola in Luero. And similarly, it was the only case. That means our systems are good at detecting and responding. So the earlier you detect, before so many people have contact with the body fluids, the better you are at containing the outbreak.
The same thing happened in Nigeria this year, where one person died of Ebola and left a line of about 300 contacts. The situation was contained, and on October 20th, Nigeria was declared free of Ebola after a 42-day count.
The threat is not yet over. I'm yet to believe that this is the high season for Ebola and also in Marburg in Uganda.
The trend of the outbreaks is more daunting than ever.
The population growth is quite big. And what is happening is that we are beginning to encroach on the forests where initially we were not going. Some people, of course, as you know, eat the bats, some people eat the monkeys, and all these are sources of the diseases. So,
as the ministry continues to trace the exact source of the Marburg virus from the health worker who died, the country also remains vulnerable to Ebola, which is still ravaging 3 West African countries, Liberia, Guinea and Sierra Leone. The Minister of Health says it is prepared for any eventualities. Florence, NTV.